Everybody, first we're going to talk about some of the assessments that we see in personal training. First assessment that we see is typically shoulder impingement test. So what we do is place one hand on the opposite shoulder, raise the elbow up, and if there's no pain, you clear the test. If there is pain, then you don't clear the test. So that's a pass or a fail test. So if you have that impingement or pain when you do that motion, that means you may have to focus on some shoulder strategies or make sure that you're not doing anything to hurt it even more or to get it checked out. For the hip, you should be able to raise the knee at least 90 degrees, okay? A little bit more is definitely common, okay, but at least 90 degrees on both sides. You should be able to control the hip as you step over a fake hurdle and back without losing control. Without that, you may have a lateral shift in your pelvis, which may mean that you need to focus on pelvic stability and core stability exercises. Another assessment you can perform is laying on your back for the hamstring active straight leg raise test. Lay on your back, raise one leg, make sure the toes are pointed up toward the sky, and again trying to get 90 degrees. If you are unable to, say this side, then just take measure, and eventually we want to be able to get that to 90 degrees with the knees straight, okay? That is hamstring. Now if the hamstrings are tight, that means you may be in an anterior pelvic tilt. Okay, so you may have to work on that posterior pelvic tilt, which would be through stability and core exercises. A way we can check out hip extension is laying on a bench and then bringing one knee to the chest and then seeing if the opposite leg stays on the bench. If the leg goes off the bench, you may have very tight hip flexors. So those are some common tests that you can perform. Another one for your shoulder is reaching behind your back, making two fists, and then measuring the distance behind your back between those two fists. So you want to be about one fist between, okay? You can count 1, 2, or 3 fists for the individual if you don't have a ruler, but you definitely want to measure that. So you're measuring one side's flexion, the other side's extension. Okay, one side's flexion, one side's extension, okay? So you may need to work more internally or externally if you're overhead, internally if you're behind the back. So those are some common assessments that you can focus on with hip flexion, extension, shoulder mobility. We talked about hip stability and core control. So let me know what you think.